I am Dr. Vivek Verma, Director Orthopedic Oncology and Joint Reconstructive Surgeries at Max Hospitals, Delhi. Today, I am going to demonstrate you the different type of products that we use in tumor prosthesis and revision joint surgeries. Hi, so now I'm going to show you the proximal femur replacement. It is not a hip replacement. It is called proximal femur because unlike your conventional hips, which includes only your neck and part of the ball and socket and the acetabulum part, here we are replacing the proximal femur as well. So this component typically comprises of this trochanteric component, the part of the head and the cup. Now this fits into the femur with the help of this stem. So this is how a typical your proximal femur looks like. When we look at the anteversion, this is at 0 degree. So when we put it inside, we need to give almost 20 to 25 degree of anteversion. So this is how it should be put inside. So where do we use this system? This I am going to show you now. Thank you. Now we are going to do a proximal femur. Important is to take the landmarks. So this is your trochanter, the tip of the trochanter, which is somewhere middle part of the head. So if you look at the tip of the trochanter falls corresponding, and our measurement is from the tip of the trochanter, which is a good landmark clinically, and we measure it till 8. So this is where we plan to take the cut. So this replaces entire head and the upper part of the femur. Even your lesser trochanter, this is your greater trochanter, this is your lesser trochanter, we are going to remove it. So we see that we take the cuts. So this, we need to ream the canal. You go in, you go with different lengths. So once we have reamed it, we need to make it now. You see the different components. This is your trochanter, this is your head, this is your trochanter, this is the head. The head size you measure it. This is the minimum length which we measured already. It is 7, and including the stem, this makes it 8 centimeter. So this is the head. These are the sites where you attach the lesser trochanter tendons. This is where the GT, the abductors are attached. Here you can attach the different abductors. So this is how the soft tissue reconstruction is done. So once you have done this, we need to insert it in the correct orientation. So you identify, do the cementation, and you take it inside. So this is when you put it, you need to give it a slight anteversion of around 20 degree, 15 to 20 degree, and allow it to cement.